Hello, my name is Amanda Acevedo, and I am a fourth-year medical student at the University of Florida. So our project evaluates the current literature and visibility of anatomy education in U.S. radiation oncology residency programs. Anatomy education is foundational in radiation oncology. Radiation oncologists need good anatomical knowledge to deliver safe and effective treatment. It's used heavily in contouring tumor and normal tissue and treatment planning and delivery. But anatomy does receive less formal attention in many training programs. Various institutions have tried to incorporate anatomy education and have found higher satisfaction, increased knowledge, and improved contouring competencies among residents after these programs. So radiation biology and physics are highlighted core subjects across programs. We wondered if anatomy education was equally prioritized. Our hypothesis was that anatomy and radiology education are underrepresented in publicly available curriculum descriptions compared to physics and biology. To review the existing literature, we used the following PubMed mesh search terms, found a total of 315 articles, and after review found that 16 were relevant, and only 3 focused on anatomy education and radiation oncology. This highlights the scarcity of formal literature addressing anatomy education and radiation oncology training. We then reviewed all 90 ACGME accredited U.S. radiation oncology residency programs and collected data from their websites on whether curriculum information was available and whether curriculum specifically mentioned anatomy, radiology, radiation biology, or radiation physics, with the goal of assessing the relative visibility of these key subjects in advertised training content. We found that 78% of programs had a curriculum posted online. 22% did not publish curricular info. This implies that even at baseline, transparency is limited, which makes it challenging to assess educational consistency. Among the programs with available curricula, all mentioned radiation physics. 99% mentioned radiation biology, 39% radiology, and 21% anatomy coursework, making anatomy the least emphasized core competency. The data we gathered suggests that there's a disconnect between the clinical relevance of anatomy and its representation in training materials. Residents may not receive standardized anatomy education, possibly impacting contouring accuracy, confidence in planning, and patient safety. Prior programs have shown measurable improvement in resident performance when anatomy is prioritized. The limitations of our study include that we relied solely on publicly available data, and internal training details may be more accurate. There was also no standard website formatting. Additionally, there was a low number of directly relevant publications. Moving forward, we would like to design a multi-institutional survey for radiation oncology residents, assessing anatomy education from their perspective, self-perceived competency in contouring, and overall educational satisfaction. This survey will provide a clearer picture of current needs and areas of improvement. In conclusion, anatomy education is underrepresented in both curricula and academic literature for radiation oncology. There may be opportunities to enhance training and align education with clinical needs. Greater emphasis on anatomy could improve clinical competency, confidence, and patient outcomes. Here you will find the works cited. And this is me. Please feel free to reach out to me with any questions you have at my email.